I'm Alexis Amudio, and I'm going to be discussing Crohn's disease. Please follow along with my PowerPoint. Crohn's disease is a condition in which the walls of the digestive system is commonly inflamed. It's usually the small bowels, the small intestines, and the colon become severely inflamed, and this causes pain, possible obstruction, severe diarrhea in some cases, and it is a very uncomfortable life to lead if you do have Crohn's disease. The disease may affect any age group and gender. However, women from the ages of 16 to 30 have been likely to be diagnosed in recent findings. Crohn's disease is associated with your immune system. However, it is unknown the causes of Crohn's disease. Some people also associate it with triggered foods and things that you eat, but again, that is not certain of what causes Crohn's disease. If maybe you have an environmental factor that can affect your immune system, or genetics that affect your immune system, this also can be associated with Crohn's disease, but again, it's not the leading cause or even known to be for sure the cause of Crohn's disease. Clinical manifestations of Crohn's disease, it's depending on the severity of Crohn's disease. There are mild Crohn's disease, moderate, and severe. Basically, depending on where you land is the manifestations that you would occur. Most all Crohn's disease does come with some form of diarrhea and some sort of abdominal pain. Of course, it will intensify and increase depending on what kind of Crohn's disease you do have. The disease does cause as I said, inflammation. This can be blockages in the intestines. The chronic inflammation can give you fever, weight loss, and just really suffer from abdominal pain, tenderness, and some can even get severe diarrhea and severe inflammation that they can't even eat, and the foods that they do eat go right through them, so they do lose a lot of weight. That is some of the manifestations of Crohn's disease. Moving on to basically risk factors. Like I said, there isn't any, so to speak, cause of Crohn's disease that we are certain of, but we do associate some ages from the young people to be more commonly diagnosed with Crohn's disease. Certain ethnic groups such as Jewish descent and Caucasians are more likely to develop Crohn's disease. However, any race can develop it, so it's not really to state that it's your risk factor. Again, any gender can get Crohn's disease. However, women are more likely in recent studies to develop Crohn's disease. Hereditary, perhaps siblings or in your family that do have it, that could be a likely chance of maybe you developing it, but there is no concrete manifestation of that. If you do smoke, you do have a higher chance of catching Crohn's disease. Also, it may worsen your Crohn's disease. So if you have already Crohn's disease and you do smoke, it could intensify what you have. There are many tests that can determine whether you have Crohn's disease or not. Perhaps, for example, CT, MRIs, a fecal blood, occult blood test, basically testing your stools, endoscopies, all the different kinds of endoscopies, the barium enema, and small bowel imaging. These can all, even a colonoscopy, can all help determine whether it is, if you do have Crohn's disease or not. I do have photos in my PowerPoint that do discuss the different kinds of severe, moderate, and mild cases of Crohn's disease, as well as a photo stating the different parts of your intestines that can be inflamed and can be triggered and can be hurt in this disease. Basically, treatment is depending on your severity of it. you may be as needing as far as surgery to remove part of your intestines that is really being suffered in this from this disease. I have a cousin who did need the surgery, and she's been living a normal life since then. But basically, anti-inflammatory medications to help maintain the inflammation, steroids, cortisone, immune system suppressors, since a lot of times because of the inflammation, because of what Crohn's disease triggers, your immune system automatically does the triggers inflammation, which can make it worse. So there are immune system suppressors that will help decrease the inflammation. However, of course, there's side effects with that because it is not boosting your immune system, it's making it lower, so that can cause some issues there. Antibiotics after surgery, and just to keep any infections from being out from the fistulas or anything like that, it can help. And any anti-diarrheal medications, because you will have diarrhea with Crohn's disease, so that will definitely help a lot. Moving on to patient teaching, basically just inform the patient to be aware of their input, their output, maybe if they see anything that can trigger anything, to just be aware of that. Also to keep a close eye on their hydration, make sure that they are, staying hydrated, stay in contact with their physicians, be alert with any things that can lead to getting in a severe case of Crohn's disease. And if that is the case, just support groups that can maybe help cope with the disease. Crohn's disease is not a death sentence. There are many people that do live with it, and I hope this presentation has given you a little better understanding of what Crohn's disease is and where we stand with it today. Thank you so much.